But that's not actually what's going on when you're starting to see that limb move again. So first, let's just talk about what happens after a stroke. Now, most people think you lose strength because that's what you can see. So you have a stroke or you have some kind of damage to your brain. Most of you know this, especially if you've been watching this channel for a while. Simplified, you kind of wipe out one of those neural circuits that helps to control movement. And what this looks like is a weak arm or a weak leg. Then for most of you, hopefully you fall into this category. After a little bit of time, you start to see the arm or leg move again. So you feel like your strength is being restored, and that if you just keep strengthening it, it's going to keep building, and voila, you're going to be back to your old self, performing all of the seemingly simple tasks again like you were doing before your stroke. But that's not actually what's going on when you're starting to see that limb move again. But more importantly, our muscles do a whole lot more than just contract, meaning that there's a whole lot more that goes into walking and moving around in our environment than just getting the muscles strong again. There's timing. We have what we call normal synergies, where muscles link up together to make us more efficient. So normal synergies would be like when you see elite athletes. I watch a lot of gymnastics, so I always use that as an example, but you see them do these amazing skills, right? They've done so many drills, they're not really thinking anymore because they have a whole lot more built in like normal synergies. They're muscles that are linked up together, so they don't have to think, okay, jump off the floor, now tuck in, and now flip my body over, right? They have some shortcut codes that just kind of kick in. We call those normal muscle synergies. All of that relies a lot on timing and some other built-in mechanisms in our system, which we'll go into when we start talking about plyometrics. But just know, just because you're getting your strength back after a stroke doesn't necessarily mean that you're getting all of these other components that are so essential to being able to move about our environment, i.e. walk, go up and down stairs, get on and off the floor, step over a curb, with as little thinking as possible. All that to say, long story short, some of the key things that you miss or that you potentially aren't getting back after a stroke is muscle timing, muscle modulation,